going to discuss the first chapter in the third pillar of the Philippine Development Plan, which is patuloy na pag-unlad or increasing growth potential. This is chapter 13, reaching for the demographic dividend across all regions. Unlike the previous chapters, you might ask me, what is a demographic dividend? Ano nga ba ito at bakit ito mahalaga sa patuloy na pag-unlad ng ating bansa? A demographic dividend is the economic growth brought about by a change in age structure of a country. Ibig sabihin nito, ang pagbabago sa populasyon, yung dami ng tao, at ano-anong edad ng mga tao sa bansa ay nakakaapekto sa paglago ng ekonomiya. Pero paano? Let us look at this diagram. These are the examples of population pyramids in varying stages, or in this case, shapes. Pag tinignan natin isa-isa sa kaliwang diagram, makikita na sa Pilipinas, mas marami ang bata o nasa edad 20 pababa. Tingnan ninyo, mas malapad yung baba o yung base ng pyramid. Sa Thailand naman, makikita natin na mas marami ang nasa 35 to 50 years old. Sa kanan naman ay ang South Korea, kung saan mas marami ang nasa 40 to 55 years old. Sinasabing ang Thailand at South Korea ay mas maunlad na mga bansa kung ikukumpara sa atin. Makikita natin sa population pyramids ng Thailand at South Korea yung tinatawag na bulge. Ibig sabihin nito, mas marami ang mga taong nasa working age sa kanilang mga bansa. Why does the economy benefit from a change or shift in age structure? Imagine nasa isang pamilya ka. Ikaw ay 13 years old, may dalawang kapatid, ang isa ay 7 years old, at yung isa ay sanggol pa lamang. Kasama ninyo ang nanay at tatay mo, pati na rin ang lolo at lola ng mga magulang ng nanay mo. Ang tanong, paano kayo nabubuhay? Kung ang mga magulang mo ay parehong nagtatrabaho, sila ang nagbabayad para makapasok kayo sa school o bumibili ng mga pangangailangan ninyo ng mga kapatid mo, pati na rin ang pangangailangan ng lolo at lolo mo. Kumbaga, dependent kayo lahat sa nanay at tatay mo na nagtatrabaho. The same is true for the economy. Those working are the ones supporting the young and the old, those who cannot work yet, and those who cannot work anymore. So what if there are more young and old people than those working? This means if you have more of these dependents, more investments and resources are needed to ensure that they are given the proper health care and education so that they can be productive when they are older. On the other hand, if there are older persons in the household, the same investments are needed for health care and other measures, such as pensions. If there are not enough people working, they may not be able to support these needs, or that nothing or very little will be left for other investments. But a shift in age structure is not enough. For the economy to thrive, those working age people should be relatively healthy so that they can go to work. They also need to be educated or trained so they can qualify for specific jobs, but only if there are jobs to find in the first place. They need jobs that provide a safe environment with living wage so that they can support themselves and their family. Para saan pa ang mas maraming nasa edad na pwedeng magtrabaho kung sakitin naman sila, kulang sa edukasyon, at hindi makakuha ng trabaho dahil hindi qualified o wala naman talaga mga kumpanya o business na pwedeng mag-hire sa kanila. So where are we right now? How are we faring in terms of shifting our age structure and realizing that growth potential? First, although our population is still increasing, as seen in the blue bars, it has been slowing down. Ang mabagal na pagdami ng populasyon ay dahil na rin sa mas kakaunti ang mga batang pinapanganak. Now let us look at our age structure. This is from the 2015 Census of Population. From this chart, we can see that we already have more productive or working age population compared to the percentage of youth and older dependents. Ngayong mas marami ang nasa working age population, mas marami ang posibilidad na mas lumago pa ang ating ekonomiya. But this is not true across all regions in our country. Some continue to have higher number of younger dependents. While we move towards that potential, we have already set up mechanisms and given necessary services to ensure that the specified preconditions are met. Nitong mga nakaraang taon, nakapagpasa na tayo ng mga batas na nagbigay ng universal access to healthcare, libreng college education, libreng contraceptives para sa lahat, at mga programa para sa mga bata o yung first 1,000 days of their lives. May mga programa rin tayong ipinatupad para tulungan ang mga kabataan na magkaroon ng trabaho. It seems we are on track, right? We saw the population structure shift and that we already have all those policies and programs to keep people healthy, educated, and working. Pero meron bang balakid para makamit ito? Ano pa ang mga issue na kailangan nating tugunan? There are four things that serve as roadblocks for us to have that potential growth. First is the unequal or uneven regional achievement. As seen in the earlier slide, the country in general seems to be faring well, but when we look at those accomplishments of the different regions, this might not be the case. May mga regions pa rin sa bansa ang mas marami ang tinatawag nating dependents. Meron pa rin mga lugar kung saan marami ang mga batang namamatay ng maaga, mga kababaihan na hindi nakakakuha ng contraceptives, at mga batang hindi makapagtapos ng pag-aaral. Second is early pregnancy, na isa sa pinakamalaking issue na dapat ayusin ng gobyerno. Mahirap ang maging batang ina. Karamihan sa mga nabubuntis ng maaga ay hindi pa nakakapagtapos at dahil dito, hindi na rin nakakapagtrabaho. Getting pregnant early also increases the risk of dying due to maternal conditions as their bodies are not yet ready to carry a child. Teenage mothers also tend to have malnourished children as well, as they may not know how to take care of their body while they're pregnant. This brings us to the third challenge, which is stunting or yung pagkabansot. About a third of our young children are so-called bansot or short for their age. Mukhang hindi malaking bagay bilang maliit naman talaga tayong mga Pilipino, kaso ang pagiging bansot ay maaaring makaapekto sa cognitive and physical development ng bata na dadalhin na niya hanggang tumanda siya. Finally, can't forget the most important looming issue, the COVID-19 pandemic. Every aspect of our life has been affected by this pandemic and reverse what we have achieved so far and may affect how we maximize our potential for growth. Itong mga community quarantines na pinapatupad ay nakakapagpahirap sa mga Pilipino na mag-access ng health services. Ang mga bata ay napilitan mag-online classes or mag-module. Marami rin ang nawala ng trabaho, lalo na sa mga kumpanya o businesses na hindi classified as essential services. So how do we overcome these challenges? Ano nga ba ang gagawin ng gobyerno para makamit natin itong demographic dividend? The chapter highlights the need to accelerate the shift in the age structure and to maximize the benefits of this demographic transition. In shifting the age structure or accelerating the demographic transition, we will reduce mortality and death rates, especially among young children. Katulad ng naipakita kanina, mayroon ng pagbaba sa dami ng namatay na mga sanggol at bata, pero patuloy pa rin nating palalakasin ang pagbibigay ng health program sa kanilang first 1,000 days. Next, the government will assist families or couples in achieving their wanted fertility. May pamilya kasi na gusto sanang mas konti ang anak nila. Nitong mga nakaraang taon, bumababa na ang pagkakaiba ng wanted sa actual fertility rates o yung gustong dami ng anak versus yung tunay na dami ng anak. Pero kailangan palawakin pa natin ang pagbibigay ng impormasyon sa family planning at access sa libre at ligtas na contraceptives. Kaya patuloy pa rin palalawakin ang pagbibigay ng impormasyon tungkol sa family planning at pamimigay ng libreng contraceptives tulad ng condom, pills, at implants. Finally, to help decrease the number of early pregnancies, innovative programs will be developed for the youth. Ipapatupad ang comprehensive sexuality education sa school curriculum. Magkakaroon din ng adolescent-friendly health service packages para sa mga health needs ng mga kabataan. Kasama na rin ang pagkakaroon ng youth development activities tulad ng sports at volunteerism. Gagamitin tayo ng social media at apps para malaman nila ang mga programa na pwede nilang i-avail. To maximize the gains from the dividend, the quality of human capital will be ensured by improving health and nutrition outcomes. Para mapanatiling malusog ang ating populasyon, bibigyang pansin ang nutrisyon at health services. Dahil mas maraming batang bansot o malnourished, mas palalakasin pa ang pagsasagawa ng school and community nutrition programs. A healthy population is not enough to drive growth, as there is also a need to cultivate an educated and labor-ready working age population. Kaya para panatilihing educated ang mga Pilipino, magbibigay ng early childhood care and development programs para mas handa ang mga maliliit na bata pagpasok nila sa school at lalawakan pa ang access sa edukasyon. We will also update our higher education or college curriculum to include new skills to be responsive to new technologies and topics or courses like data science, nanotechnology, and machine learning, among others. The potential to growth following the possible demographic transition may be rendered irrelevant if the population wanting work cannot be productively employed. Therefore, we also identified strategies to include youth and female labor force participation. Para dito, tutulungan natin ang mga kabataan na makatransition from school to work through internships or apprenticeships. Gagamit rin ng online platforms katulad ng PhilJobNet para mas madaling hanapin ang mga trabahong ito. Para naman mas marami pang mga kababaihan ang makapagtrabaho, maaaring ipatupad ang flexible work arrangements at ang pagkakaroon ng daycare at child-minding facilities. Another factor to harness the dividend is to ensure that as the working age population grows, there will also be savings build-up among the population. Para magawa ito, bibigyan natin ng access sa mga Pilipino sa iba't ibang financial products katulad ng savings, checking o current accounts, at pensions. Kasabay nito ang pagsasagawa ng mga economic and financial literacy classes. Lastly, we will improve the integration of population and development planning and programming, especially among local governments, to ensure that every LGU is implementing the strategies and interventions so we can maximize the gains. Again, ang gusto nating mangyari sa buong bansa ay mas marami sa atin ang may kakayahang magtrabaho at kumita ng maayos para maginhawa at panatag ang buhay pati na ng ating mga dependents. This is what Chapter 13 is all about. Sana'y naipaliwanag ko kung ano ang strategies ng gobyerno para makamit ito patungo sa ambisyon natin 2040. Isang matatag, maginhawa at panatag na buhay para sa lahat. Maraming salamat po at mag-ingat po tayong lahat.